Hey, it's Birdman for Summit Healthcare's, and today we're at the Pediatric Center that's off of Cub Lake Road. That's right behind Papa John's Pizza, if you're looking for those geographic landmarks. And if you don't know where that is, it's, just across from the hospital, so you're not going to go towards the hospital, go the other way. I've got with me Dr. Andrew Jones. How are you, sir?
Good, how are
And you're all board certified and everything.
Board certified pediatrician.
Yes.
Yeah.
And you're one of the three that's here.
Mm-hmm.
We're going to talk about a couple different topics, and we're going to start out with something that's top of mind and should be top of mind for everybody, and that's the flu, correct?
Yeah.
Yeah, so tell me what's been going on here with the flu and some of the things that you want people to know about it.
Yeah. So the flu has reached epidemic proportions. And then, how do they say when it's an epidemic or not? It just depends on how many people get it and how fast it's spreading.
Right.
And so this year, there's been a lot of people with the flu, especially influenza A. There's multiple different types of flu, and they all kind of give you the same symptoms. But when we test for them, we can kind of test which ones are bad and which ones are not so bad.
Mm-hmm.
So we've mainly been seeing influenza A, but over the past week or so, I've been starting to see some influenza B too. So multiple strains kind of going through the community.
Okay, what's the best defense against the flu?
Yeah, so I think there's two things I usually recommend. Vaccines, obviously, there's a flu vaccine that can really help out. And then just general nutrition. So getting good sleep, staying well hydrated, eating good foods, and washing your hands is probably one of the biggest things you can do. Influenza is spread by droplets, and somebody sneezes or touches something or whatever, and you touch that and then touch your face, or you eat food that's share somebody else's fork or things like that. You can just share that around. So hand washing is the biggest thing to do, and hand washing is like not just I'm gonna run them under water and then fling them off and be done. You gotta wash good with soap and water, or use like the the Purell, like the alcohol gel sanitizer stuff can really help too.
So I've heard you use the soap and you sing happy birthday, and if you sing happy birthday all the way through, that's usually about the right amount of time.
Fingers and on the back, get the nails. Yeah. And then don't touch your face afterwards.
Yeah, that's a good idea. Now, so you said, obviously washing it. One of the things that we heard from the other episode we talked about was stay away from people. Well, when it's a kid, and you go to school, yeah, so that's sort of like self-propagates around and around.
Right.
So getting your kids to do these things and teaching them, one, through example is probably good, right?
Yeah.
Okay. Talk to me about the vaccine, because there's a lot of people that have a lot of fears about vaccines all by themselves. Yeah, their children in it like compounds the fear.
Right.
What age can you start with a vaccine?
So for the flu vaccine, it's 6 months. So once they turn 6 months old, they can start getting the flu vaccine.
Yeah, and I want to just let everybody know I have a 6-month-old.
Mm-hmm.
Guess what he just did? He got his flu shot.
Good job.
Yes. So, now's the time.
Yeah, for sure. So the first time they get the flu shot, and there's lots of different rules and stuff on how often they get it, but usually the first year they get the flu shot, we actually do 2 doses. So they'll get 1 dose, and then 1 month later we'll get another dose, kind of to cement into the immune system's memory that, hey, this is what the flu looks like.
Right.
And the flu vaccine contains actually 4 different strains. They pick 2 strains of influenza A and 2 strains of influenza B. They make their best guess based on like what's going on the other side of the world as it moves around and gets to us. That being said, viruses mutate. So sometimes, like this year, it's been about 10% effective. Meaning for that specific influenza A strain, if 100 people got the vaccine, 10 would be totally protected. And the others, it probably still helps minimize the amount of illness.
So it does, and that's the thing. 10% is obviously better than 0.
Right.
But even if you have it, you've introduced this thing into your system that then teaches your system how to fight it, so the effects aren't as bad, right?
Right.
But
I usually like to think of vaccines as like, to put it basically like pieces of an elephant.
Okay.
Right. So I'm going to give the body a trunk and an ear. Okay. And say, okay, this is what I think is going to go around this trunk and ear. Your body may say, that's an African elephant, and I've recognized an Indian elephant, but they look about the same. They got a trunk. I'm going to take that thing out, or I'm not going to let that thing go too crazy.
Right.
And so even it may not be a total protection, it can still kind of help your body recognize things and fight things off better.
So it's doing that. But can you get the flu, or can your kid get the flu from the vaccine?
Flu shot? No. So it's flu shots nowadays, because it's an actual shot, is inactivated, meaning they take a virus and they kind of beat it up to where it doesn't work any popular. They give pieces of it. Previously, they would do the flu mist where they give it in the nose. That was a live vaccine, so you could get the flu from that vaccine. That didn't really work a couple of years ago that just realized it wasn't working to really prevent the flu, so they just took that off the market.
Right.
So we don't even do those. But the flu shot itself is inactivated. It's not a live virus. It can't get you sick. That being said, lots of people will be like, oh, I got the flu shot and then I felt crummy 2 days later.
Right.
And the answer to that is yes. I mean, when we give vaccines, we want our body to react as if they were sick, right? So you may get chills, you may get the fever, you may not feel well, but that's not necessarily the virus that's causing that. It's your body kind of reacting to things and saying, fevers aren't caused by bacteria or viruses. It's our body trying to fight off those things.
Right.
And so when somebody says, oh, I got a flu shot and then I got a fever the next day, then I say, great, your immune system is working.
Right.
And that's a sign that your immune system's working and that it's taking all that and actually turning it into good memory to fight things off.
My little boy didn't even get a fever. So yeah.
And it's pretty well tolerated.
So
some people get it, but most people don't have any problems with it whatsoever.
very good. There's one other thing with vaccines, mercury in the vaccine. Is that, especially with 6 months old ones, worry about that.
Right. Yeah. So there's a lot of different companies make a lot of different vaccines. The answer to most of the mercury question is no, especially in the single vial. Usually the mercury and some of the other ones were in multi-vials to kind of keep that vial from having problems.
Right.
There's usually what's called an adjuvant that gets added to a vaccine to kind of get your immune system to recognize, hey, there's something here that we need to fight off. But for mercury and is this bad enough? There's different kinds of mercury, and the answer is no. You can probably get more mercury in your body from eating a fish that you caught out of the ocean than from the vaccine. So does it cause long-term problems? No, it doesn't.
Okay, cool. Anything else we should know specifically to kids about the flu vaccines or anything going on with the flu virus?
Yeah. So when parents will ask, what can I do for the flu? Say their kid has the flu. If they're severe enough, like, hey, we need to go to the hospital or things like that, Tamiflu is a medication. Usually don't have medications for viruses, but for the flu, Tamiflu is a medication that we can use.
Right.
That's got to be started within the first 24 to 48 hours to actually be effective. And then it cuts down the whole illness by 16 to 24 hours. So it's there and it's helpful, especially in the super sick people and kids, pregnant ladies. Some of those things we recommend those more often. Just to prevent super bad illnesses. But that is there, but it's kind of got to be started at the very, very beginning of the illness.
Right.
And the other thing in any kind of viral illness that I worry about for kids, the two big things I worry about are dehydration and respiratory distress.
Okay.
So dehydration, when a kid gets sick, they may not want to eat as much, and that's okay. Drinking is probably the more important thing, as long as they can stay hydrated. And with the flu, you can have vomiting, diarrhea. So some kids can get dehydrated.
Right.
Tears, things to look for to say, hey, is my kid dehydrated? Especially little kids. Do they make tears when they cry? Is their mouth wet, and how are their wet diapers? So if they're making tears when they're crying, they're drooling all over, and they have good wet diapers, then your kid's pretty well hydrated.
Good.
If the opposite is there, it may be like, hey, time to go see the doctor.
Okay. Scale of when you go to what? There's doctor's appointments, and then sometimes you can't always get a doctor's appointment.
Right.
Can you walk in here?
Sometimes,
yes,
not always,
okay.
not really.
Okay.
Not like the walk-in clinic.
Then when do you make the decision between an urgent care or an emergency room visit?
Yeah. So, it depends on how bad it is.
Okay.
Like urgent cares, some of them they may not have the ability to do IV fluids.
Right.
So if your kid was doing fairly well, but today's day 4 of illness and they're not making any tears when they cry, their mouth looks dry, they're not eating, and they're not peeing. That's a good reason to go to the ER, because they can start an IV, they can make sure everything looks okay. Respiratory distress, if they're having a really, really hard time breathing, or you go to the doctor and their oxygen saturation is below 90%.
Right.
Most of the kids have to be admitted. So going to the ER helps you get admitted. Going to the urgent care, they may be able to take care of it a little bit, but they're going to send you to the ER eventually to get care of. That being said, if they're drinking well, they're just not feeling that great, they're having fevers, and you just want to know, hey, is this an ear infection or is this the flu?
Right.
What's going on? That's a great reason to call your doctor and try and get an appointment, or go to the urgent care and say, hey, how bad is this? Because if they're not that bad, they'll give you helpful tips to go home and take care of it yourself.
Very good. So Dr. Andrew Jones here at the Pediatric Center for Summit Healthcare. Anything else?
Yeah, I'd say the last two things with kids specifically, helping them learn how to cough. So when you cough on your hands, they'll say, tell your kid, cover your cough. They cover their cough, then the next thing they do is they touch everything. So kind of coughing into their elbow kind of keeps the illness away from their hands and away from their face. And the other thing is, how do I know when my kid can go back to school? So if your kid's having symptoms, vomiting, diarrhea, runny nose, those are all kind of infectious, right? if we took every kid out that had a viral illness, school would get closed down from October
Pretty much.
to March.
Yeah.
So what we usually say is if they've had a fever within 24 hours, they should not go to school. And then obviously if they're not having fevers but are vomiting and diarrhea,
Right.
obviously not go to school.
Yeah.
So if they're feeling super crummy, probably keep them out. But if the fevers have resolved and they're getting better, then you can kind of judge and say, hey, how bad is this, and can you go back to school?
There you go. But your first line of defense is, as he said, the shot, the vaccination, and then washing hands.
For sure. For sure.
If your kid's like really upset that you're asking them to wash their hands, you're just close to doing it enough.
That's right.
Very good.
That's right.
Awesome. So thank you very much,
Yeah, my
Dr.
pleasure.
Andrew Jones, here at the Summit Healthcare Pediatric Center on Cublick Road. I'm Birdman. For Summit Healthcare is reminding you, be healthy. Hey, make sure you follow us because Angie Fabian has a 5-story office.
5 stories.
Click up there, click down there. Yeah.